Namaste. In this session, we are going to discuss on history of social work education in Asia with a specific reference to India. Learning objectives. By the end of this session, learners will be able to trace the historical development of social work education in Asia, examine the influence of colonialism and Western models on Asian social work including India, identify the contributions of key countries including India and institutions in promoting professional social work education, analyze the challenges of adopting and indigenizing social work practices in diverse Asian contexts. Finally, recognize the role of international organizations in shaping social work education and training. These are the synopsis countries we are going to discuss in this session. Introduction. Asia is the home to major religions like Hinduism, Buddhism, Islam, Christianity and Jainism. Religions in Asia promoted compassion and assistance to their needy people. The strong tradition of charity and helping the poor is the inherent of the religious traits in the Asia. Charity traditions were not allowed to evolve into professional social work as in the West. The most Asian countries colonized in the 18th and 19th centuries. Colonialism brought changes in indigenous systems. It also imposed Western welfare models. The post 1940s and 1950s United Nations helped to initiate social work education in Asia. So, let us start discussing about Bangladesh. Bangladesh faced frequent natural disasters and there was a war 1971. After the war, refugee crises were there in the Bangladesh. Bangladesh was major recipient of foreign aids and many national international organizations worked in Bangladesh. In 1953, Bangladesh started a professional course for 3 months, then in couple of years it has been converted into 9-month job training. In the year 1958, College of Social Welfare and Research Center was started as a constituent college of University of Dhaka. Then in 1973 it became part of the University of Dhaka and started offering degrees in social work. Sri Lanka got independence in 1948. Sri Lanka was influenced by socialist ideology. The welfare state of Sri Lanka was very strong. The welfare programs was very effective. As a result, the development indicators are very high. There are trained social workers, but the low representation in the bureaucracy due to dominance of the government departments, also ethnic conflicts, family based security. However, profession slowly gaining acceptance. In 1952, Ceylon Institute of Social Work was established. The Sri Lanka was earlier known as Ceylon. In 1964, this institute was taken over by the Ministry of Social Service and renamed as Ceylon School of Social Work. Later in 1978, 2-year full-time diploma in social work was started and in 1992 it was upgraded to National Institute of Social Development by an Act of Parliament. So, this institute started offering graduate degree, diploma, certificates in social work and counseling. Next, Indonesia. Indonesia got independence from Dutch rule in 1949. The country faced political instability when communists attempted to take power, but government's strong measures led to serious human rights violations. With regard to social work education in Indonesia, 1957 the first training program was started for the ministry employees for 1 year program, 2 years program, like that. In 1964, School of Social Welfare was started and started offering UG and PG programs. There are 33 public and private universities offering UG programs. 4 public universities run master's program in social work. Next country is Malaysia. Malaysia got independence from Britain in 1957. In Malaysia also communist uprising suppressed violently. In the year 1946, the Department of Social Welfare established by colonial government. Training need of the social welfare officers were realized. They trained at London schools of economics. Mostly the officers were the Britishers. In 1952, University of Malaya started a certificate in social work, then diploma in social work. In 1957, PG diploma in medical and social work was started, and then UG degree was started in 1968. Later, several universities in Malaysia started UG programs. Philippines got independence in 1946, but retained close ties with the USA. Social work education strongly shaped by American models in Philippines. In 1950, social welfare section was started under the Department of Sociology and Social Welfare in the College of Liberal Arts in University of Philippines. In 1961, it became a separate department of social work. Now, College of Social Work and Community Development offers BS, Diploma, Masters in Social Work and Community Development, and it also offers Diploma and Masters program in Women and Development. Vietnam. Vietnam faced multiple wars with Japan, France, USA in the 20th century. 1975, US troops left, then unification of North and South Vietnam happened. Political upheavals had a major impact on the development of social work in Vietnam. 1947, School of Social Work by French colonial government was started, later run by a religious organization. In 1957, Vietnam Army School of Social Work was created and started offering 2-year training and short courses. In 1968, National School of Social Work with the support of UNDP, UNICEF, UN organization was started, and they started offering 1-year program, 2 years program. In 1970, Vietnam Association of Social Workers was started and it joined International Federation of Schools Social Work. Social work discipline introduced at Dalat University, Van Horn University. In 1975, Communist government stopped all social work education and professional practice. So, during 1975 to 1986, no social work training or practice in Vietnam. Then in 1989, Center for Social Work Training and Research was established. 1992, Ho Chi Minh City Open University added social work to BA program. Then Faculty of Sociology now offers BA in social work. The challenges for social work education in Vietnam are lack of a code of ethics in training and profession, limited recognition of social work as a formal profession. Next to China. 1921, Social Service Department founded in Beijing Hospital by an American social worker and provided in-service training, casework, adoption and rehabilitation services. In 1922, Yenching University established a sociology department with the support of Princeton University professors. Later in 1925, it was renamed as Sociology and Social Services Department. By 1930, social work program existed in 12 universities in China. 1949 communist government was established in China. As a result, 1952 all social sciences including social work was banned as materialistic value courses. Social welfare activities continued, but no professional training. For 30 years, China had no contact with Western social work. Late 1970s, economic reforms reintroduced social sciences. 1982, sociology was in 12 universities. 1986, social work and management was also added. 1987, 4 universities launched UG social work programs. Then 1994, China Association of Social Work Education was founded. In the year 2002, over 90 universities and colleges started social work training programs in China. The rapid growth of voluntary social work and civilian organizations happened at this time. Japan surrendered to Allied forces, that is US, USSR, UK and France in the year 1945. Then Allied occupation was existing until 1951, which paved the way for reforms to democratic society. In 1946, training school for public assistance workers started and later it became Japan College of Social Work. In 1950, Doshisha University initiated first master's program in Japan. In 1955, Japanese Association of Schools of Social Work was formed with 12 schools, and during 1950s there was a great debate in Japan among the social work educators how to call social work, as professionals or specialists. This was the debate. 1960s, welfare services expanded with economic growth, and 1970s criticism of westernized curriculum was started in Japan. As a result, social welfare laborer term became very popular in Japan. Then professionalization in Japan. Late 1970s, Ministry of Health and Welfare proposed a law to regulate social workers. There was resistance initially. In 1987, Certified Social Workers and Care Workers Act passed. In 1994-95, out of 514 universities, 13 universities as well as colleges and 11 junior colleges were members of JASSW. Now, Japan has about 100 universities with the Department of Social Work or Social Welfare. Less number of graduate program under them, 40 master's courses and 23 doctoral courses are there. Junior colleges and training schools also active. The challenges in social work education in Japan. Japanese Association of Schools of Social Work has not yet unified graduate level curriculum policy. Next, South Korea. In 1923, the first modern social work institution implemented in community work programs. 1940s, medical and psychiatric social workers started hiring in hospitals. During 1950-1953, Korean War devastated the entire society. As a result, more than 10 million people affected, including children. Many children became orphaned. Foreign aid crucial in relief activity, and many orphans adopted abroad. So, during 1970s and 80s, economic prosperity improved the life of South Korean people. In 1987, transition from aid recipient to aid provider, it is a very significant milestone in the growth of South Korea. Then government employs 7,800 civil social service workers. Now 200 plus social work programs, 20,000 students enrolled. There is a distance learning program which is expanded now. Then there is a national level exam, in that 12,000 plus candidates register yearly for the first class social worker license. Among them 30 to 40% candidates are passing the exam. 70,000 plus social workers in various agencies are working in South Korea, Saudi Arabia. Islamic Kingdom, 5-year development plans shaped welfare of the Saudi Arabia. In the 4th year during 1986-1990, detailed social welfare programs were initiated. In the 8th plan 2006-2010, there were rehabilitation initiative, care, remedial services also there, which was focusing disadvantaged groups, juvenile delinquency, poorest in the villages and towns. Social work education emulated from West, basic level degrees are also offered. Degree via university departments, social work or sociology and social departments were offered in Saudi Arabia. Next, Israel. There was a great depression among the Jewish population in the Palestine, which faced poverty, unemployment. In 1931, Jewish community invited American social worker to establish Department of Social Welfare under the provisional government. Then American and British welfare concepts were introduced in Israel. In the year 1934, the first 1-year social work training course was started, focused on public welfare and immigrants absorption. Mostly trainers from USA and Germany in the Israel. Next we will come to India. In India, there were early experiments in rural development. Gurgaon experiment 1920 by a British officer introduced literacy, sanitation and cooperative farming. Then Marthandam experiment in the year 1921 initiated by Spencer in Travancore, in that OMCA was leading and it promoted vocational training, health and self-help groups. Sriniketan project in 1922 initiated by Rabindranath Tagore, aimed at self-reliant rural communities through education and crafts. Then it comes Gandhian model, Sevagram experiment, Wardha by Mahatma Gandhi, emphasized village self-sufficient, khadi, sanitation and community living. Social work education in India. The first professional social work education in India was established in the year 1936 by Sir Dorabji Tata Trust in the name of Sir Dorabji Tata Graduate School of Social Work in Mumbai. Founder director was Clifford, American missionary. So, American influence on Indian social work was there. Later the institute was renamed as Tata Institute of Social Sciences, TISS. In the pre-independence 1936 to 46, there were generic curriculum. Later it has become specialization approach, specializations like medical and psychiatric social work, family and child welfare, criminology, correctional administration, labor welfare and industry relations. The social work education in India was shaped by the priorities established in the United States. The emphasis was on curative social casework with less attention to need the social and economic development or promotion of preventive services and social action. Expansion social work education in India. Social work spread to other cities like Delhi, Chennai, Kolkata, Lucknow and Bangalore. During 1950s to 70s, India was supported by UN agencies and Ford foundations for curriculum development. There was a growth of UG and PG programs in social work through universities. Then community development programs in post-independence period. The first major initiative for integrated rural development, 1952 launch of community development program. It covered agriculture, irrigation, health, housing and village industries. It aimed at people's participation and decentralization. Then Panchayat Raj system, Balwendra Mehta committee recommended local self-governance. Panchayat Raj became the backbone of community development projects, and at top of it 73rd and 74th Constitutional Amendment Act 1992 strengthened the Panchayat Raj system in India. Impact of Western priorities in India, American models unsuitable for India's socio-economic realities. Great social work educator Gore in 1988 writes, professional social work in India focused on consequences rather than causes of poverty. Social workers largely from urban middle class backgrounds focused on providing relief rather than addressing root causes and preferred urban career opportunities. So, in this background, differences in social and economic backgrounds within India made it difficult to develop indigenous social work education standards. Adopting social work across cultures, imported US alcoholism treatment models failed in Indian context. Joint family structure required new approaches in India. It shifted to family and community oriented therapy. Then group therapy also adopted, where leaders gave advice and added education. Then it comes to role of social workers in Indian context. Social workers often viewed as gurus imparting knowledge. Developed close ties with the families beyond counseling session. In India, working only on the table in the counseling session does not work. So, need to go out of the counseling table, need to go out of the four walls to the family, rural community. It is very much essential. So, as a result, moved away from the strict 12-step model originating in the West. So, applied critical reflections to adopt methods developed locally started working. Then global dimensions in social work in India. Professional social workers realize that events in one country can influence practices and policies in another country. Example, issues like HIV/AIDS, migration, crime, environment impact all countries. The recent example is COVID. The author Noble in 2004 writes about future of social work. Post-colonial social work needs revival of marginalized voices. The agenda should be accepting the differences, justice, cultural diversity and inclusive dialogue. So, hence revising global guidelines to reduce Western dominance in Indian social work education is very much essential. The challenges right now in Indian social work education are over dependence on Western models of social work theory and practice, limited emphasis on indigenous knowledge and practices, focusing village institutions, caste and community structures. The present scenario in India, over 500 colleges and universities in India now offer social work programs UG, PG and PhD. UGC model curriculums are developed. There are professional associations in the country in various places and national level also. The Government of India has come out with the National Commission for Allied and Healthcare Professions Act 2021, which regulates the medical, psychiatric and clinical social workers. This is a great recognition for the social work profession in India. So, the growing focus on rural development and poverty alleviation, HIV/AIDS, gender justice, migration, disaster management, environment and corporate social responsibility. There is a upcoming field child protection also. Government has introduced a national level policy, national level program on child protection. So, then increasing demand for social workers in NGOs, government agencies, CSR wings of corporates and international organization. So, with this we conclude this topic. Social work education in Asia has been deeply shaped by colonial history, Western models and international organizations. Each country shows a unique pathway influenced by political change, wars, welfare policies and cultural traditions. The challenge remains to indigenize social work education. The future of social work in Asia depends on balancing global standards with local needs, ensuring relevance and sustainability. With this we conclude. Thank you very much. Namaste.